Hey, Dr. Lindsey and Wendy here. This we're going to go through pretty quickly. This young guy, he's 31, right?
Yes, doctor. I just lost a dog.
He is a class 6 fine-haired guy with a good color contrast who's now out from 2 surgeries, and we're doing a 3rd little surgery the day we started this video to try to finish off his crown. So this shows what we can and cannot accomplish on you younger, fine-haired guys. Issue 1 is you got to have a hairline that's going to look okay when you're my age, so we do my hairline, not one of these straight across things. And issue 2 is we got to put enough hair per square inch to make it worthwhile. It's still fine hair, but it's got to be enough, right?
Yes.
So look at this video. It really speaks for itself. Kevin, it's okay I use your picture on my YouTube site?
Yes.
So how old a fellow are you?
I'm 31 today, actually. It's my birthday.
Oh, happy birthday.
What's your birthday today?
And we started whittling on you about 19 or 20 months ago, I think, right?
Yeah, that's about right.
And I'll put pictures up showing you before. And you look good. You're a fine-haired guy with a big color contrast, and a good-looking wife. Is she happy with the results?
Yeah, we have been, definitely, for sure.
And have I been pretty truthful with you on things?
Of course, yes.
All right, Wendy, comb that hair one time, please.
Oh God, maybe so short. That looks really good.
Yeah, it does look good. And this is indirect lighting with a relatively short haircut. Now spin around one time and let's see where we're going to put hair today. Look up at the ceiling. So we're going to start right where we stopped before.
Right there.
And try to get as far as we can. Chin back down again, and then hold for a minute. So that looks pretty good. And we'll get that out and sew you up. And hopefully hear from you next Christmas. Turn back around. Anything you think that somebody watching this should know about the whole event or me or anything?
It's not really that painless.
Painless or painful?
Not very painful. It's painless.
Okay.
And it's taken very well. Happy with the results.
All right. Thanks a lot, man. So what do you think, Wendy?
I think that is what guys that come here 27, 28 years old, that they have already a class 6. And when they hear you say, your curse is thin hair, that's a real state to cover.
Yep.
Right? And you can see, like, their shoulders go down. And then you keep on going, say, 1 here, 1, 2, crown, maybe never.
Right.
And when you hear those words, it's like there's no hope for me. They're only 27, right? And there's like, oh, no hope. But these, and then you go on and you show them pictures, but this is the results that they can expect. Right,
with fine hair,
with fine hair, color contrast, and different things like that. So I think just hear, if you hear that, it's like, ugh. But then when you see this results, it's like, I'll be happy with one of those.
Yeah, most guys would be happy with that, but if you feel like you gotta have everything covered or nothing, then you probably shouldn't have anything, And we're blunt about that. So because you need to know, just like I need to know when I buy something, what the realistic outcome probably is going to turn out to be.
Yes, like the guy that called today, he's like, I don't want it to be a sham.
Right.
Right? And you're going to come in a year when the results come in. If we say, oh, yeah, we can give you, the stars.
I don't want to be a sham or a scam, either one.
Yeah, and then, when you come back, it's like, well, this is what we showed, and we go, and we got 99% of our patients that know exactly what they're going to get.
Yeah.
Yeah.
So as you're shopping and doing research, just make sure you look at plenty of pictures of guys that have hair like yours. Next, make sure when you meet with the doctor, not some sales chick or sales guy, that you meet with a doctor and make sure that you discuss these issues. And thirdly, make sure you look at a few pictures that doctor has done of guys that look like you. And if there aren't pictures of those or they don't want to show you, I just wonder why, So if Wendy and I can help you, please give us a call. Thanks.